Just give me 1 second. Yesterday we covered theory of intelligence, and before that behavioral psychology, or theories of sorry, this is theory of intelligence. Okay, I will. Okay, so now start mental disorders. So in mental disorders, first we are going to study stress. So we know that stress is just body's response to changing stimuli or stressors. Simple definition of stress is the body's response to changing stimuli. Body's response to changing stimuli. That is stress. Stress is not always negative. Stress is positive and negative. This theory, this definition is given by Hanselling. That stress is not always negative. It may be positive or negative. This given by Hanselling. First time. De-stress and eustress given by Hanselling. Stress. It's not stress that kills us. It is our reaction to it. That definition given by Hanselling. Next, that's concept of stress having two categories, distress and eustress. So eustress is always positive, is always energizes, motivate us to make a change, or we can say it gives us capable of overcoming from every obstacle, every challenge. Okay, that motivate us in every field, that is eustress. You know, before going to any exam or sit in exam, we are very nervous because we don't, why we are nervous, because we don't know what will happen after that. Maybe there is more different question can ask which I don't know anything. Okay, so that is the nervousness, we can say. That will be positive, that will be positive if we take that nervousness, stress in a positive way. Before exam, 1 or 2 days, we always study too much because we have eustress, we have positive stress. If that stress is distress, then we cannot study. Before exam, the stress is always must positive or eustress that motivate us to read, to study. Okay, so eustress is positive, distress is negative. Distress is always demotivate us. It make us mentally sick. It make us demotivate or incapable of overcoming from any obstacle. If we have distress, then we can not upgrade in our every field. Okay, because distress always put us down, not motivate us. It gives us negative stress. Okay, so this is important concept. The eustress and distress. In stress, this given by Hanselling. Next is how distress impact you. Yes, how eustress. Okay, so it's simply showing that distress and eustress difference. That if you have distress, then you can feel or these type of symptoms, or if you have this type of thing, then you can say that it is distress, or in distress, these are these are showing that lack of sleep, fatigue, headache, mood changes, change in appetite, shortness of breath, chest pain, digestion issues, feeling overwhelmed. First, this is uh, mental disturbance, then it slowly come in physical disturbance. Okay. So in distress, while you think or um, have some any aim to goal to get it, so these, if you have distress, then these are problem you can see. Or if you have you stress, or you are taking that stress in positive way, then you can find out increased energy before exam. Your energy is increased, motivated, you are get motivation, increased focus, create excitement, self efficacy, increased productivity, positive outlook, increases resilience and lack of focus. Okay, means you this is not point. Okay, lack of focus, because our focus is more increased in stress. Okay, we are motivated, more challenging, more confident if we have stress. Okay, so that's the simple difference between distress and eustress. If you have distress, then this type of um, symptoms you can see. And if you have eustress, so you are full of energy, confidence, okay, motivation. So that's it. Okay, shall we move?
Yes, ma'am.
So, ways to change your mindset. How can we change our stress, or okay, how can we change our mindset from de-stress to eustress? Okay, means if now I feel that every time whenever I going to start any exam, or before the that exam, while I'm practicing, I always feel disturbing, or that practice, that tension gives me no any benefit. Okay, my exam can go more worst, because I am taking so nervousness. So what should I do then? Focus on breathing. In yoga, how can we use this? Focus on breathing. Tell me. It may be meditation. Okay. It may be nadi shodhan. Nadi shodhan, we can start anulom vilom. Focus on breathing. Alternative breathing. Focus on breathing. Anyone else?
शीतली
Okay,
शीतकारी
next. Yeah.
शीतली शीतकारी पण
Very good. Very good.
Ujjayi, which can be done at any time, ma'am.
Shitali, Shitkari, or Brahmari also. Okay. Kapal Bhati is very low impact in the field of, if you are talking about stress. Am I right? Because Kapal Bhati simply focus on our abdominal area. Okay. Next is talk to someone. Here we can use talk to someone. What is sadhu sang, sat sangati. Okay, talk to someone. Find ways to stay busy and distract you. Stay busy and distract you. So here we can start uh, reading. Okay, reading ancient texts. We are studying this in perspective of our yoga field. Okay, so stay busy. It means we are hard. practicing any hard work, or can also follow tapa. Okay, stay busy swadhyay. Okay, exercise asana, get more sleep, deep sleep, so that our delta or delta and theta are more active, and it makes a good memory. Okay. And then write, think positively. This is by Ishwar Pranidhan, or by reading books, ancient books, holy books. Meditate is uh, also a good point. Meditate, you can also write it. So question can ask in exam, like they give options 3 or 4, that these are 3 meditation or simple breathing techniques, and some one is different. So you can understand there that for going de-stress to eustress, you will have to know that it needs some focus on breathing, meditation, thinking. Okay, then you can analyze from that MCQs. Okay, so is it okay now?
Yes, ma'am.
Anyone doubt?
No, ma'am.
So that type of question if asked, so you can do that. One question is like that. Second question is maybe from eustress or de-stress. Third question maybe asked eustress and de-stress given by Hanselling. That question we can ask. And what type of yoga or breathing exercise we can perform in stress, while you have stress. Next is depression. Okay. So depression is a serious mood disorder. It is mainly a mood disorder. Characterized by persistent feeling of emptiness, sadness, and loss of interest. This type of simple characteristics you face in depression. Depression is a mood disorder, or we can say serious mood disorder, that characterized by persistent feeling of emptiness, sadness, and loss of interest in every activity or in your life. It affects depression, it affects how a person think, act, or feels. How any person uh, thinking, acting, or feeling. How it influences. That is called depression, or we can say depression affects a person's thinking, acting, or feeling. Okay. Following types of depression. These are some I had mentioned important types of depression. Major depressive disorder, persistent depressive disorder, dysthymia, and perinatal depression, seasonal affective disorder. Seasonal affective disorder is not so much important. Okay. Next is depression with symptoms of psychosis. This is most important. And symptoms is a person with depression may present with the following principal sources. That is low mood, reduction or loss of pleasure or in any activity, significant changes in weight or appetite, lack of sleep, insomnia. These are some disorders which are after starting by depression. Maybe excessive sleep, hypersomnia, or maybe you can also feel narcolepsy, parasomnia if you are in depression, fatigue, loss of energy, feeling of worthlessness, indecisiveness, or problems with concentration, suicidal thoughts. At last, you can see suicidal thoughts, plans, attempts. So these type of symptoms you can see in depression patient. See, this is serious. You are many persons think that I am depressed. That are not. Mm, everyone are not. Depression is starting when this is create disturbance in their daily activity. If your mood are very low in many days, it is not means you are depression patient. Okay, it means this is maybe 2 or 3 months regularly mood disorder. This is creates seriously mood disorder and affects your thinking, act, and feelings. Then you can say you have depression. Okay. So anyone have doubt? Next is types. So here we are talking about major depressive disorder. Major depressive disorder is a most uh, famous, we can say, most important. Firstly came major depressive disorder. It can cause a what it can cause low mood, sleep disturbance, difficulty in focusing, a low of motivation, and other symptoms like which we had studied in the major in depression symptoms. These symptoms plus these symptoms, these create major depressive disorder. Okay. Anyone, if individual can have major depressive disorder, he had persistently low mood for 2 weeks. 2 weeks. And a loss of interest in activities which they usually enjoy or they do in daily activity. These type of disorders or uh, symptoms can, if they can say, this is in major depressive disorder. Next is persistent depressive disorder, PDD. Persistent depressive disorder, formerly called dysthemic disorder. It includes the symptoms feeling depressed or irritable, having a poor appetite or overeating, having insomnia or sleeping too much, experience fatigue or low energy, having low esteem, trouble concentrating or making decisions, feeling of hopelessness.
Ma'am,
Persistent depressive disorder.
can you admit Aarti, ma'am? I think she's waiting in the admit room.
Oh, I don't make anyone's host. Please give me. Okay. Now, so this is persistent depressive disorder. Persistent depressive disorder is also most important depressive disorder. Major depressive disorder is the starting phase, we can say, and after that persistent depressive disorder started. That is also known as dysthymic disorder. That's it. Okay. Anyone have doubt?
No, ma'am.
No.
Major depressive disorder, it is uh, showing their highest peak in 2 weeks. Okay. And persistently, slowly it is increasing. Okay. Next is postpartum depression. Postpartum depression. Allo, this is uh, this comes when postpartum, prenatal, postnatal. Sorry. Here we studied perinatal depression. This is perinatal depression is this postpartum depression. This is after pregnancy, after delivering birth, and after uh, one year of delivering of birth baby. Okay, after 1 year, female feel depression. The cause is not find why they feel depression, but it has shown in many data that females are after 1 or 2 years they feel depressed. Okay, so symptoms are nearly same. Okay, headache, anxiety, fatigue, low mood, low motivation, and a lack of interest in activities, feeling unable to care for the baby, difficulty bonding with the baby. It is not means that she is not love to his baby, but she is feeling, okay, she is feeling that I cannot able. These type of things, having no interest in the baby or feeling as if they are another person's responsibility. Okay, sometimes they can feel this. So this is postpartum depression or postnatal perinatal depression. After that coming psychotic depression. In depression, you can also see some psychotic um, disorder also. So it comes in psychotic depression. It means while you have depression, you can uh, face from hallucination, delusion thinking, that comes under psychotic. Hallucinations, delusion thinking means you always think that there are someone who are looking or who want to kill me. Anything you can feel, and that is not true. Okay, that come under in psychotic depression, in hallucination or in delusion. Anything that is not real but you think that is real, that come under in hallucination, delusion. You think that person are talking by me and they want to kill me, they are planning to hurt me. That type of thing come in hallucination and delusion. And while you have depression and feel that type of symptoms also, then you can say you have psychotic depression. Okay, these are some the most important depression disorder, depression types. Okay. So in psychotic depression, you can what can you do as point of yoga? Tell me.
Ma'am, giving
Meditation.
them
Yeah.
practices like
Which are dynamic in nature, ma'am. We should
ask
not
ma'am.
give.
Hmm. First, we can give them
Ask
as
ma'am.
whether we are
So,
not
Suksh,
eligible to give them counseling, but we can give them talk therapy. We can just talk. Firstly, we can hear what is running in their mind, what is thinking, why are they thinking. When we talk, then they tell that I think that they want this, they want to kill me, that type of thing. They will tell you in talk therapy. Okay. After that, you can give them simple breathing techniques. Okay. So that your their sympathetic and parasympathetic both balance. Okay. And slowly they can get to know that this is okay. In psychotic depression, what is main thing that they are not known that we have problem. Their hallucination, delusion, they don't know that it's problem. They think it is okay. So that is anyone question? Should we move?
Yes, ma'am.
So this type of question they can ask related with any disease, or they can ask therapy also. You can ask your teacher in therapy class about these diseases also. That if we have person depression or stress, so what practices he or she can do, can perform. This is
Okay, ma'am.
important. Okay. Hmm. They can
She's
ask.
taking
Uh,
the therapy aspects based on the five koshas, ma'am. For Ranamaya, she's suggesting mostly dynamic practices like asana, loosening, and pranayama, different kinds of breathing like sectional, nadi shuddhi, brahmari, and all that, depending on the disease.
yeah, yeah.
And for Manomaya, counseling, yogic
Hmm.
counseling, and
Hmm.
lectures. For
Yeah,
Anandamaya,
this is
some
very good.
yeah, for Anandamaya, happy assembly and Krida yoga and all that.
Mm-hmm. Very good. Mm, main thing is we cannot practice yoga nidra or deep meditation in this depression, because we have already very mood disorder or very sad mood. Okay, so if we are practicing yoga nidra, that follow this thing, so in it is maybe problem to patient. Okay, are you able to understanding that in
Yes,
if
ma'am.
that is a serious patient of depression, so we never start from yoga nidra. Never start from yoga nidra in depression. We always go for when they are medium patient or very now they are good enough to understand, then we can start yoga nidra. Okay. Depression patient, we cannot give them yoga nidra or deep meditation. Just start focusing on normal pranayama, simple breathing. Next is okay, anxiety. So anxiety, what is anxiety is simply understand that worry, anxiety, fear from anything, any place, any person, any situation, and that fear, that worry, anxiety is enough to interfere in your daily activity. That is known as anxiety. Everyone have very small fear, small anxiety to any related with any situation or person, but when they are interfere with their daily activity, and that's over, we can say extra, that is come, then we can say this is anxiety. Mental health disorder characterized by feeling of worry, anxiety, or fear that are strong enough to interfere with one's daily life. This is important in this definition. When a person feel interference with within their daily activity, then we can say that it is anxiety. Next is common anxiety signs and symptoms are, this is most important symptoms: nervousness, restlessness, or panic attack. Maybe they can see if they are serious patient of anxiety. Maybe they can showing increased heart rate, high BP, or thrust, breathing rapidly, hyperventilation, maybe sweating, trembling. These are very high symptoms of anxiety when the patient is very serious. Trouble concentration, weak, feeling weak or tired, having trouble sleep, GI problem, controlling worry, difficulty controlling worry, urge to avoid things that trigger anxiety. Okay, these are very special, or we can say main signs and symptoms which we can see in patients of anxiety. And these are some uh, symptoms of the patient who was very serious in anxiety. Okay, so this is anxiety. First thing is to remember is worry, anxiety, fear that interferes with your daily activity, that is known as anxiety. Okay, and its complete opposite is mood disorder is depression. Okay, shall we move?
Yes, ma'am.
So that is anxiety. Now we discuss about types of anxiety. These are some common types of anxiety: generalized anxiety disorder, panic disorder, selective mutism, social anxiety disorder, specific phobias, substance-induced anxiety disorder, and that is example of a phobia. So generalized anxiety disorder are persistent and excessive anxiety. What is it? Persistent and excessive anxiety and worry. That is generalized anxiety disorder. First nervousness is came, worry, then it comes in anxiety, and then generalized. It is more serious. Serious. Even ordinary or routine work, with routine issues, you can feel disturbance in every work. Worry is out of proportion to the actual circumstance. It is difficult to control and affect. Anything which you which anyone can think that this thing is not uh, taking nervousness, anxiety, that type of thing, they can nervous. Any type of daily activity, they can feel nervous if patient is generalized anxiety disorder. Okay, it often occurs along with anxiety disorder or depression. It is occur with other disease, other disorder. Okay, next is panic disorder. Panic disorder is patient is got panic or heart attack, or panic means their tension, their worry, their nervousness is getting to peak in just few seconds or minutes. Okay, these episodes, repeated episodes of sudden feeling of intense anxiety or fear, repeated episodes, and or terror that reach a peak within minutes that reach to peak, that is panic disorder. And when it is going to peak, you can feel shortness of breath, impending doom, or we can say chest pain, rapid fluttering or pounding heart palpitation too much, These type of special signs you can see if you have came a panic attack. It means serious and suddenly anxiety, and that anxiety is in a highest peak in just few seconds or minutes. These panic attacks may lead to worry about them happening again or avoiding situations in which they are occurred. That patient, that person always uh, want to avoid that situation. From that, they get panic disorder, panic attack. Like if they are uh, meeting with that person or going in that place, then they give panic attack. Then they are worried to go there. Okay, to meet them person. They avoid that situation. That is panic attack, panic disorder. Selective, next is selective mutism. It is generally it can be seen from in children. Is a consistent failure of children to speak in certain situations. That's some children, they are very comfortable or exactly or simply talk with their family members at their home, but suddenly when they can face some situation or any friend, teachers, they are unable to speak, or we can say they are trembling in their speech. That type of problems came in selective mutism. Okay, consistent failure of children to speak in certain situations. Maybe they can they are feeling unable or incapable of speak in front of principal, teacher, or any friend, or in any situation. These are come under in selective mutism. But actually, in at their home, they can talk easily, simply. So that type of patient come in selective mutism. Okay. Next is social anxiety disorder, social phobia. Social phobia, phobia from outside world, out social situations. They think they are feeling of embarrassed and they feel self consciousness while going out. They feel that that person in surrounding will judge me, or maybe they will make negative comments, negative thinking regarding me. That type of views or feelings they have if anyone have social phobia. Okay. Involves high level of anxiety, fear, or avoidance of social situations due to feeling of embarrassment, self-consciousness, and being judged by others. That person have social phobia, social anxiety disorder. As they go in society and afterwards and out from home, they feel nervousness, anxiety, tension. I mean, worry. I mean, social anxiety disorder. Specific phobias are phobia from lizard, phobia from water, from dog, from cockroach, anything, any type of phobia. Phobia from height. That are specific phobias coming under in anxiety. Okay. Next is substance induced anxiety disorder. If you are taking some medication or taking that drug, taking wine or anything, after that you feel anxiety. That is come under substance induced anxiety disorder. Misusing drugs, taking medication, being exposed to a toxic substance, or withdrawal from drugs. While you going to withdraw from drugs, from wine, from alcohol, then these type of anxiety disorder you can also feel. Okay, many times we see that the patient who going to leave the alcohol uh, taking, then this is most difficult, more difficult. Uh, they want to leave the alcohol. Okay, so these show them anxiety while leaving them. Okay, this is a patient of high using alcohol, drugs, or any medication is come under in substance induced anxiety disorder. Next is agoraphobia. It is a type of spatial phobia. Okay, a type of anxiety disorder in which you fear and avoid places or situations. Okay, this is type of social anxiety and specific phobia that cause panic and make you feel trapped, helpless, or embarrassed. You feel that no one can uh, get to help you, or they can harm you, they can kill you. That type of feelings uh, came in agoraphobia patient. Okay, so what should we do if you are yoga therapist? If you have agoraphobia phobic patient, first is talk therapy. You just to understand what is coming in their mind, what are they feeling, which type of anxiety, worry came in their mind. Okay. After that, yes, anyone? RTG,
Yes, ma'am.
tell me.
First of all, you told the talk therapy.
Hmm.
Then we will do the pranayam breathing exercises.
Okay.
And then we will go for the asanas and then meditation also. But
Okay. While they are standing in that situation, that they are worrying, anxiety, nervousness. Okay, at that time we cannot perform anything. Okay, but in regular routine, they can do pranayam, asana, meditation, dhyana, everything. Okay, because they have no any physical disturbance, physical disease, so they can perform asana easily. And pranayam meditation is beneficial for them. Okay.
okay, ma'am.
Ma'am, talk therapy helps.
Yeah, talk therapy helps.
And yogic counseling, like telling them that fear is created in their own mind and there is nothing like that. Everybody else feels okay in that same situation, but they are the ones who are feeling this because of that mental makeup.
Mhm. We just tell them that what is anxiety, what is phobia, what is it reality of phobia, that it is nothing but simply your um, thinking that you get the phobia from them. Okay, slowly we can start show them that situation, that person, meet them, that there is nothing taking any fear from them. Okay, that is normal. Next is this is okay. This is list of phobias. Just read it, or you can learn if you can. Like cynophobia, fear of dogs, and fear of insects, bug, entomophobia. I just simply mentioned this. if you get somehow it is important, or I'm making a short tick which I think that this is important. One is that agoraphobia. That's important. One is fear of dogs or fear of, but that's enough. These you simple can read it out. Coaster phobia, roller coaster, coulrophobia, fear of clowns, or you can go to Google also. Okay, that other type of phobias. You can think that this is important. That phobia from height, phobia from water. Um, these you can mention in your notes. Okay, fear from crowd. This is important. Fear of crowd. Inoculophobia, fear of accidents. Dystrychophobia, fear of schools. Didascleinophobia. That's it. Okay. Most important, you can check it out. Um, fear of height, fear of height, fear of water. Okay. So, anyone have doubt? So they can ask
Ma'am,
me any type of thinking, and sorry, any type of any topic which you want to cover, which I had not covered. So you can tell me.
All topics are clear. Syllabus is finished.
Yeah. Okay. And maybe tomorrow or day after tomorrow, 2 or 3 days, we solve all the question answer which came from 17 to 22, 2023, 22. Okay. In that net exam. And that we also get to know that this type of this topic will not cover, or this topic will need more study, more reading, so then we can get. Okay, and after that we can take more class or 1 or 2 class. Okay, it is no
okay.
problem. Hmm.
Ma'am, can you
After
share the
question answer,
updated slides, ma'am?
yeah, today I share you.
Yes,
Sorry, to
ma'am.
yesterday I can't share because I 2 or 3 slides are missing out from my slide. So I mm, make slide again today. Okay. So shall we end the class?
Yes, ma'am.
Okay. I will mention to more list which is more most important. Okay. I can leave it out. Okay.
There is
Types of any.
claustrophobia, there's hydrophobia, and there are
Yeah. That's why I'm saying that is important. Phobia of height, water. I will mention in that slide. Okay. Today.
Yes,
yes,
ma'am.
ma'am.
Hmm. Okay. So thanks to all.
Thank you,
And
ma'am.
if you're thinking that any topic is ma'am not
Okay.
study, then you can tell me or message me. Okay.
Okay, ma'am. Thank you.
I'm collecting all the questions last year or from 17, 18. So then we will discuss after the all collecting by me.
Yes,
Okay.
ma'am.
Maybe
Yes, ma'am.
tomorrow or day after tomorrow, 2 or 3 days, we'll complete question answer. From tomorrow, maybe next class will start. Okay.
Yes, ma'am.
Yes, ma'am.
Like we can do it after 2 or 3 days. Before that, if you give the slides, we can cover up the, like we can revise
Yeah.
once and
Today,
then we
today I will
can.
give one slide. This slide I will give.
Yes, ma'am. Yes, ma'am.
Hmm.
Like after revision, we can go for the solving. Then we'll be
Yeah.
able to solve the questions better. Thank you.
Hmm.